Hi, I'm Dr. Reuben Varghese, and I'm the Health Director and Public Health Division Chief for Arlington County.
Kim Durand, the Coordinator for the Arlington Partnership for Children, Youth, and Families.
Nancy White, President of Arlington Free Clinic.
I'm Abby Raphael, Co-Chair of the Destination 2027 Steering Committee. Join us in conversation.
So I have gotten into this through the Partnership for Children, Youth, and Families. I've been the coordinator now for 8 years, and the partnership's actually 20 years. And over the past 20 years, we have done our community report, formerly called the report card. We've done 5 of those. And over the years, with each iteration, we've sort of noticed that the averages that we're reporting in some of the charts and tables are really hiding what's actually going on in the county. And so being able to pull out some of the disparities as our data has gotten to be a little bit more sophisticated, and we can do that with the new technology, has really made it an exciting time, I think, to look at all of this data and think about what are the different ways that we can serve our community based on what we're finding out in our data. And so whether it's the Youth Risk Behavior Survey or now the Your Voice Matters, or just some of the other data that we collect, like the BMI data from various VPI programs, it's just very interesting looking at all of those rather than the straight average by school, by gender, by race, ethnicity, by 504 plans, by you name it. And how are we going to help the pockets of our community that really could use the help? It's exciting.
That is very exciting. It's actually reminiscent of where I started. In medicine, I went to medical school because I said I wanted to help people. And when I was in practice, I was able to treat people, but they weren't getting better in the cure sort of phase. And I was like, well, there's got to be some other way of doing it. And so I started thinking, looking back, that I have been thinking about upstream, how do our populations have the right behaviors? And I was thinking, okay, we'll focus on risk factors and improve people's health by encouraging them to lead better lives and better behaviors. And that was, in a sense, what happened with Destination 2017. We were focused on trying to make conditions better for people to, just if they knew that they shouldn't smoke or they could exercise, life would be better. Well, it wasn't quite true still. There was something not happening. And when you see a decade of difference in life expectancy in Arlington, wow, I mean, that's a game changer. And as a physician, the doctor for the community, it feels important to share it with folks and saying, look, you all, this is your health. How are we going to solve this? And realizing there's a context in which those behaviors need to occur. And that's where the disparities and inequities are at issue. Is the context in which people are living, how do we get them to realize it is important to take care of your fellow neighbor? And so for me, that was really the opportunity in a community as progressive as Arlington is. We can do something about it. And, trusting the universe, I'm seeing people actually interested in trying to move this forward.
Well, I first started getting interested in the concept of equity when the Robert Wood Johnson Foundation came out with their data, over 10 years ago, probably 15 years ago, that showed that access to health care was only a real small portion, about 10% of the whole total picture of what encompasses someone's health. And realizing how at Arlington Free Clinic, when we see patients that come to us, by the time they get to us, they have diseases that they shouldn't have. Their diseases are more severe than they should be. They have harder times getting good outcomes because of the lives that they've led, the conditions in which they live, and those may be their educational level, their housing situation, the conditions in which they grew up as children, and seeing how we can still provide and help them with health care, but the outcomes are never going to be as good because of the conditions that they've been living in throughout their lives. And it's been really interesting for me to be part of this Destination 2027 process because it's really brought to light some of the data behind the conditions in which our patients live, and how it's really shed a light on how difficult that challenge is and how important it is for us to address these factors in order to truly help them improve their health.
When I was a member of the school board, we focused a lot on disparities, and the board still does that, of course, and that's mostly around academic achievement. And despite years and years of really concerted work and attention, we still have these disparities. I know when I was a member of the board, I was particularly interested in student health and wellness and how those relate to academic achievement and all the factors that go into whether students are healthy, community conditions that we'll be talking about today. So I was thrilled when Dr. Varghese invited me to join Destination 2027. And we've talked about Arlington is such a wonderful place, and our schools are among the best in the country. We're constantly ranked as the best place to live, and all sorts of wonderful achievements. And we should be proud of that. We are proud of that. We've worked hard for that, but that's not the experience that everyone in Arlington has. So by being transparent and really looking at what do we need to do so that everybody has the opportunity to thrive, that's really what equity is all about.
I can repeat once again, isn't it just dramatic when you hear there's a 10-year, a decade of difference between Roslyn and Buckingham, which is near Ballston. It's about a mile. Can you imagine where you live and who you are could actually impact your health? That's just mind-blowing. And I'm sure you've all seen different disparities that resonate with you.
I hear a lot about the problems with access to mental health care. And if you look at the data of the mental health conditions or the mental health needs in those who make less than $50,000 a year compared to those that make more, it doubles when you get into those low income groups. And access to services are so limited in that population, many times because of lack of insurance or lack of coverage of insurance and Medicaid policies and the like. And so it's really hard to get healthy if you have severe depression or if you have severe anxiety. It's hard to remember to take your medicines or to trust those that are caring for you, and that care is so needed. But it really struck me to see that the need really doubles when you get into the low income groups. Mm-hmm.
Another striking disparity is the teen birth rate. It's 11 times higher for Hispanic youth than it is for white youth. That's remarkable. Also, children living in poverty, the rate is 5 times higher in certain neighborhoods than it is in others. And again, we're 26 square miles, so to see those disparities in this small county is just remarkable. I know when we've all shared that information with people, they're really stunned.
And the disparities that we can even see in school systems, and it wasn't created by the schools, but they're part of the community conditions. The free and reduced lunch program differences where one school may only have 1% of the population needing free and reduced lunches, and we have an elementary school where it's 80%. Think about that sort of, what is the experiences for those children? How do you learn when you're reliant on those sorts of different conditions? As Abby, you were talking about, these disparities are the result of policies that may not be all equal, and they have different outcomes, just like the educational disparities or the health disparities that result.
Well, and I'm flipping through because I don't want to get my data wrong, but we have so much information in this report. But really looking at some of the data that we have around physical fitness really is striking in some of the disparities, because the kids that exercise 1 or more hours a day, 5 days a week, which I believe is the current recommendation, it might even be more than that. But for the white students, it's 69%. But for our students of color, it's only 51% get the daily recommended. And then that's at middle school, and high school is even lower. So it's really, when you break it out like that, and then you also can look at some of our data that we have around healthy weight. And the BPI students are really recording much higher rate of students entering kindergarten at risk of overweight or obesity. And so we can't point fingers at the schools and say, well, it's the school lunches. It's entering kindergarten. And so it really is looking at our 26 square miles and what can we as a community do about that. And it's related to the food insecurity, it's related to the food deserts, it's related to where you are in the community, but also, struggling parents who are running from soccer to, whatever club is next, and then to do the homework and, what's on the way. Something that's not so healthy, probably. So there's just so many different things that our families are contending with.
I often tell a story about the differences between a woman, a friend of mine with breast cancer, and one of our patients with the same diagnosis, and what they have to go through in order to get to a good outcome. And, a friend of mine might be able to take 6 months off from work or go part-time. Their home is paid for, their children's education is paid for, they have a car, they have health insurance, they have benefits, they have friends that bring them food. We had a patient with a woman whose husband had left her. She had 2 children. She lived in an apartment, no car, 2 jobs, and a breast cancer diagnosis, and no security at all with that. And she missed 1 day of work. She had surgery, chemotherapy, and radiation, and missed 1 day of work because she knew if she missed more work, she'd lose her job, which would mean she'd lose her apartment, she'd lose her network of friends that were helping get her kids to and from school, and they'd end up in the shelter. And so you see these changes that people make, and in order to get that care. And so she missed the day of her surgery. That was it. And she relied upon the generosity of donations that we had for transportation to get back and forth to her treatment so that she could go in a vehicle instead of a bus to get to her appointment, so she could only miss 45 minutes of work instead of, a day. And so it's, you see the burdens that people have in order to even get care when the care is free and available for them.
Those stories are so important because we look at data, but it masks the human element. These are real people, and it is affecting their lives. After looking at a lot of data and hearing a lot of these stories, the steering committee that you brought together, Reuben, which represented 40 different organizations in Arlington, it was really a great cross-section of the community, I think, came to this conclusion, right? Disparities exist, this matters, this is not okay. And that sounds kind of basic and fundamental, but it took us a while to look at all that and really get to that. And I think a lot of folks don't appreciate that these disparities really do exist here, and they're just not consistent with who we want to be as a community and who we say we are as a community.
But do you think that everybody in the community is even aware of them yet? I mean, we've been talking about it because we're on the committee, and everybody that will listen to us, we talk about it with, but are we really at a place where everybody has seen the bicycles and knows about equity versus equality? And
especially if you read the newspapers and you always see Arlington as being number 1 or number 2 in health indicators and all of these data pieces, and you assume that that's the way the community is, and those averages really hide some of the true stories of how hard it is for a slice of our community that very often goes unnoticed.
I think it's why we have to be intentional about getting these messages out and realizing we're not going to be in an echo chamber and just talk amongst ourselves. One of the questions that we'll get to is that we're always going to be asking, how do we know what we know? Let's stop doing thought experiments. Let's look at the data and keep recalibrating and asking, what's today's reality? Are there people, Nancy, I think you mentioned the woman you had talked about, she had burdens. There are other people who have benefits. We need to be more intentional about the questions we're asking, and I think that's one of the things that came out of this is let's be more intentional and do it earlier on so that we can know who benefits, who's burdened, and who's missing. And you have to actually talk to real people. I mean, we've done some things, and I've always been impressed, Nancy, in our grant process where we talked about when you talk to real people, what do you find out? What's going on?
No, it's been really interesting. We've got a collaborative going on that between 4 organizations, the Arlington Pediatric Center, the Maternal and Child Health Clinic at DHS, the Virginia Hospital Center Outpatient Clinic, and Arlington Free Clinic, that over the past few months we've been collecting data from all of our patients, our new patients as well as our existing patients on these factors that we're talking about tonight, of what are their barriers to health, and asking them, do they have struggles with knowing that they're going to have enough food to eat, that they'll have a place to live, that they will be safe in their home when they go home at night and safe from domestic violence, and some basic questions. And when I proposed that to our eligibility staff to start to think about that, they said, oh, we don't need a questionnaire because we already know, we can tell who needs help. And these are very seasoned employees, and they do know a lot because they spend a lot of time getting to know people. They're like, oh, we know. I said, well, let's just try it and see. And let's do a pilot, and we'll test and test about 10 or 15 a week and see what happens. And after the second day, one of the staff members came to me and she said, I already know that you're right. That she said, I sat down and she said, this was someone I knew already that was a happy-go-lucky, sort of fun-loving guy, one of our patients. He's always in a good mood. And I said, oh, come and let us test on this. And she said, when we got to the question about feeling like, there's a question that says, do you ever feel that you lack companionship? It was about social isolation. And she said, and he started to cry. And she said, it totally caught me off guard because I never would have expected that from him. And to realize how, what a big deal this was, that it had brought emotions to him, and also how easy it is for people to put on their nonprofit face, their agency face, and come in and do what they need to do so that they can get out, get in, get out, and get to work, and that we really don't know. And she said, I'm committed to this. And then last week she came in with 2 more people, and we have a question at the end that said, are any of your needs urgent? And she said that for the first time someone checked that box, because we don't want anybody to do the survey and not feel safe going home without us being able to take action. And so she said, this is someone I've worked with for a long time. And she checked that box, and I said, can you explain this? And she sort of had a bit of a emotional moment and said that she needed to go back into counseling, and agreed. She had stopped her therapy sessions and agreed to, at that point, to come back in and go back to therapy as a result of just having that conversation there. And she said, I am committed right now to doing this data collection, because she said, we really can't tell. We just don't know what people are walking around with and what their barriers are. So
I'm going to bring us to the CPN Community Progress Network, just because it seems like such the perfect time to segue into that. Because from my standpoint, where I sit with the Partnership for Children, Youth, and Families, we look at the data and we struggle with, well, how are we going to make sure that folks know about this? Because it doesn't do any good sitting on my desk. What can I do? And so there's been a group of folks through the Community Progress Network who have had these large meetings where they're bringing in a lot of different people to talk about these issues, your clients and the DHS clients and the people who are really part of the Arlington community, who sometimes we forget about their voice. We're so busy trying to do things we forget that we should be doing things with. And so they've done such a great job of providing help with transportation, providing food, providing childcare, so taking away some of those barriers so that they're in a place where we really can hear their voice. But how can we do that? So that's been great. That's 150 people, and they've done that 3 times. But as some of my members would point out, 150 people in the population of, how many are we now? 200,000 plus? How do we get to the rest of those folks? But, so how do we get to hear those stories, to understand how can we survey everybody so that we know what their needs are and figure out how we can support them?
And there's a lot of conversation going on about how do we take that model that was so successful.
Yeah.
There was also interpretation in
Yes,
5 or
yeah,
6
that's
different
right.
languages, and building trust over time, where people came to a number of these and realized their voice mattered. They were heard. We really cared what they were saying. And they shared with each other, which was really remarkable too. And one of the takeaways from all 3 of those sessions was lack of information about education, about housing, about health care. Some people had figured out the system, had a caseworker, had access to lots of resources, and others knew nothing. So how do we get that information out? That seems to be a big challenge.
And another piece, too, to back up even further, is that it's not so much how do we get this voice, but how do we all accept that we need this voice? Right. Mm-hmm. And I think that has to happen. It's so easy to go about your way, and the people that show up to meetings are the voice that you hear, and to recognize that we're missing a voice, and that acknowledgement of building that access into the processes that the county uses and that nonprofits use, that we as an organization use when we're making a decision about what sort of services we provide. It's like it's easy for us to sit back and decide, as Kim says, to do things to people or for them and not with them. And I think it's that acknowledgement of we don't always know.
Well, and it goes back to what you were saying about, I know what my clients need because I know them. They come in, I know them. But we need to test our assumptions. Do we really know what they need? Have we asked them? And just to throw in youth voice a little bit, we have learned a lot through the group that the partnership works with, the Teen Network Board, because they really have an amazing voice. And when you ask them, they will tell you exactly how we can work with them. So, the them is what we need to figure out. How do we work with everybody in the community in a way so that they feel heard and important and involved in their own decision, in their own health, when we're talking about health equity.
And part of what we've learned from that is a one-size-fits-all approach doesn't work. We need to communicate with people in different ways, in ways that work for them, at times and places that work for them. And I think that brings us to the conversation that we had a lot during the steering committee about the difference between equity and equality. And I know, Reuben, you brought this wonderful image that's so bicycles. Arlington because it involves bicycles.
Absolutely. So I make sure that it's upright.
Yes, it is upright.
Yes.
Okay. So for folks who can see
Want
it,
me to hold it for you?
That would be terrific.
I will
Thank
be
you, Kim.
Vanna.
So we often have an equality lens where it's the one size fits all, as Abby was talking about. We give everyone the same resource and expect everyone would be able to get to the outcome. And what we have to first of all realize, look at the bicycles, they're individuals, but think of them as populations. So you've got a person who's in a wheelchair, you've got someone who's very tall who has to hunch over, you've got a woman who appears to be the right size bag, and a child who's having difficulty. If each of those are populations and we're trying to get to health or to educational wellness, only one of them is going to get there intact. The others are going to either not make any progress or they're going to get actually hurt in the process. And can you imagine public policy where we have policies that are hurting people? It may not be our intent. So we need to look at the outcome. An equity lens, each population has the bike that will let them get to the outcome of interest. So if it's good health or good education, imagine if we could give people the bicycles that they need to get there by population. And so that's really, let's be intentional about not only the process, but the outcome. And that's really what I think we're trying to all talk about, is changing the lens as how we make decisions as decision makers. So thank you for holding that.
And to broaden that out a little bit, I think when we think about the definition of health equity, and there are lots of them out there, we talk about everyone having access to the community conditions needed for optimal health and well-being. And so in that example, it's a bicycle, but we talk about community conditions involving housing and transportation, food, social connections, a number of factors that all go into health and well-being in health and also just generally in thriving. We've focused with Destination 2027 on health equity, but really all those same community conditions are what affect whether or not people thrive generally.
This is a community that has always wanted to do well by its citizenry, and it's part of our DNA and our tradition. So we do very well reacting to things. I think there are a number of things that we've seen that we have been able to solve, like the 10-year plan to end homelessness. We recognized there was a problem, that the conditions weren't right for everyone in that sense. Things like the child care initiative saying there's a problem, we're going to try to fix it. So that part, I think, is part of our DNA. Now can we go further upstream and maybe deal with some of the policies that create some of those conditions so that we go from reacting to being proactive and prevent in the true sense of the word so that everyone can thrive from day one, not just after the fact.
So you've used the word upstream a couple of times, and just to make sure that everybody's aware of that. I mean, I love some of the links and things that you sent out when we first started doing Destination 2027 that really talked about that. But can you just explain it a little bit?
Sure. So if you think of policymaking as a stream in a sense, or a river, rivers usually go upstream to downstream. Those who are at the bottom are going to be affected by whatever happened up top. And so let's stop fixing things at the bottom, like throwing the life preserver. Maybe we can actually prevent the need from the life preserver when the policy decisions are being made at the top of the river. And so just earlier, let's be intentional with the questions we're asking. Let's not assume everyone can benefit, as some of our eligibility workers may think, oh, we know what's going on. Let's ask, who benefits, who's burdened, who's missing, and golly gee, let's actually talk to them and find out what we're doing.
We had a great video that we shared during Destination 2027 on upstream, downstream, and it showed a child in a river and drowning, and people see the child go by, and then another child goes by, and another child goes by, and they keep trying to pull them out one by one, and finally someone says, hey, let's go upstream and figure out who's chucking these kids in the water. And it's a pretty basic thought. Yeah, let's not be downstream figuring out what's happening down here. Let's figure out what's causing these kids to get in the water.
I had a conversation the other night with someone at an event, and she had grown up, she's a Native American, had grown up in a reservation that had lots of services, and all of her family still lived there. And she said, and I was asking her about the health care there, and she said, over the past 10 or 15 years especially, there has been so much health care provided there that it's really easily accessible. I said, is the population healthier? She's like, oh no, not at all. She said they can get health care, but the conditions in which they live, their health habits, the addiction, the alcoholism, the domestic violence, all of the issues, the education as well. But she said that it is not a healthier population. It's an unhealthy population that can just go to the doctor when they get sicker, and they're putting Band-Aids on issues that needed to be addressed. And some of that is lifestyle behaviors, but some of it is conditions and all. So it's important for us to really think about what's going on there.
So if we were to think about what one message each of us would probably want to give, I know what I would want to think. We're a caring community, and we can do something about this. We've got the mettle to be able to do it. We've got the heart to do it. We just need to change our questions and be intentional in that question asking. And so I have hope that we can actually achieve equity in Arlington, and hopefully by 2027.
I would add that I think we need to build some of the structure or the systems in place that allow for APS, Arlington Public Schools, and the county services, whether it's Parks and Recreation or libraries or courts or DHS, and our nonprofits, to really build some structure in place where there's a free flow of knowledge and supporting one another in our efforts out in the community, so that we're not trying to duplicate any efforts, but we're really supporting each other in our work. And I just would love to see, one of the biggest things that I got out of Destination 2027 was collaboration versus coordination. And it's great if we can all coordinate and just make sure that we all know what each other's doing. But if we can work together to create something new, which is collaborate, how exciting would that be to really take the lead in this and create something and be the leader?
No, I so agree. I often say that that if you can do anything anywhere, you should be able to do it in Arlington. It's one of the wealthiest, healthiest communities, counties in the country. It's also one of the smallest, and we all know one another. We all sit around the same tables and talk about problems together. And if you could ever solve a problem, you should be able to do it here. And I think that this issue is ripe because there's data to support this, and there is enthusiasm around the community leaders. And I think we're taking the first steps to really see some change that's going to make a difference for those that really do need it the most.
Absolutely, and there's been lots of work around this. There are lots of different organizations. That's why the collaboration is so important, so we can bring government and nonprofit and the for-profit community together. We did recommend that the county adopt a policy on health equity and create some kind of entity to implement that policy so that there is a structure, and then to infuse in all decision-making the questions that you keep coming back to, Reuben. Who benefits, who's burdened, who's missing, and how do you know? And if we can start to do that, and that's work that we're all doing and our colleagues on Destination 2027, I think it's really going to make a difference.